Let's talk about a little different way of looking at how we clean the mouth. And the title of this video is the concept of oral decontamination. Oral decontamination compared to oral debridement. In dentistry, oral debridement or plaque control refers to the removal of dental plaque on the teeth and is a component of oral debridement. Removal of bacteria on the tongue, especially on the posterior third of the tongue, using a tongue scraper is another example of soft tissue debridement. But after the teeth and the tongue have been debrided, significant bacteria remain on the soft tissues, especially on the posterior third of the tongue. Over-the-counter mouthwashes kill bacteria and is referred to as a decontamination. However, the least expensive, most effective decontaminant is sodium hypochlorite, which is the active ingredient in household bleach. 1 teaspoon to a plain unscented bleach in a quart of water has been proved to be very effective. Substantivity is a persistence of effectiveness of a topically applied solution, determining the degree of physical or chemical bonding to the surface. And in general terms, this means that whatever is adhering to the surface cannot be removed by sweating or swimming or bathing or from any type of friction. And certainly we're not talking about swimming and so forth on the tongue, but what we're talking about is a solution that bonds to the tongue and persists for a period of time. And sodium hypochlorite, as well as some mouthwashes and chlorhexidine possess this property. However, sodium hypochlorite kills on contact, whereas you have to rinse for about 2 minutes with chlorhexidine and some of the mouthwashes to have the effectiveness of it. So when you incorporate the principle of substantivity along with the least expensive, most effective decontaminant, then sodium hypochlorite wins hands down. Now, chronic inflammation has been shown to be a negative factor in the following diseases: cardiovascular disease, diabetes, multiple sclerosis, Alzheimer's, Parkinson's, and rheumatoid arthritis. And this is the thing that we would like to combat with our decontamination. Periodontal disease can be a major contributor to chronic inflammation and can have a negative effect on those aforementioned diseases. This dilute solution of sodium hypochlorite can destroy bacteria and environment in the oral cavity, the nose, and actually in the sinuses. By decontaminating these areas, the following diseases theoretically can be prevented. And this would include the common cold, pneumonia, bronchitis, any sinusitis. And it may also have a positive effect on the progression of COPD. But let's talk about the human papillomavirus virus. This has been implicated in cervical cancer, oral cancer, and anal cancer. Irrigating these areas before and after sexual activities may prevent these cancers from occurring. Other indications. This can be used for treating any fungus infection like an athlete's foot, and I'm finding it's being very effective in treating a toenail infection or fungus, which I have had for many, many years. The debridement of the teeth followed by decontamination has been found to be effective in preventing periodontal disease as well as halitosis. That's a general statement. But think about this. Following periodontal treatment, if residual defects remain, in other words, we don't get rid of all the pockets, these can be maintained using this solution in a water irrigator or a water pick. So let's talk about a postscript on this. During flu season or at times of seasonal allergies, flushing the sinus with a saline solution may neutralize and nasally irrigate, and this may not only allow the symptoms to be abated, but also prevent the onset of the disease. So hopefully I've given you some ideas to consider, and certainly incorporating decontamination along with oral debridement in your practice could have a positive effect not only on dental health, but on the general health of the patient as well.